Welcome to the Meet Melbourne Graduate, the Insider Story Master of Public Health webinar. I'm Peter Hatono, and I'm the Student Recruitment Officer from the Faculty of Medicine, Dentistry and Health Sciences. I will be your moderator today. So good evening, and thank you for taking the time today to attend this webinar. I'd like to start by acknowledging the traditional custodians of country throughout Australia and their connections to the lands, sea, and community. We pay our respect to the elders, both past and present, and extend that respect to all Indigenous Australians attending our session today. It's really quite exciting to see that we have more than 300 people registered today, coming from all over Australia, overseas, and all in different time zones. So welcome to all of you. So here today we have Dr. Melissa Russell, the coordinator of Master of Public Health from the Melbourne School of Population and Global Health. We also joined by our alumni who completed their Master of Public Health and currently working at many different sectors, basically. So we have Elle, who is currently working at the Department of Prime Minister and Cabinet. And we have Max, a business analyst at Alfred Health, and Martha works at the Center for the Health Equity. So feel free to type in your questions anytime during the webinar in the chat box. And we have fantastic staff who will be more than happy to answer all those questions. I will also address some of the questions during the Q&A sessions. I also like to mention that this webinar is recorded and you can access them afterwards. So I guess tonight we will start with Melissa talking about Master Public Health, and then our alumni will share their personal experience and journey. And then we will conclude the webinar by answering some of your questions in the Q&A sessions. I guess without further ado, I would like to pass the time on to Melissa to kick off with her presentation. Thank you, Melissa.
Thank you very much, Peter. And T, would you like to move on to the next couple of slides? That would be great. Thank you very much. And lovely to speak to you all today. I hope you can't hear my cat, which has just decided that it would like to go out the door. So hopefully she will stop doing that. So perfect, we can stop there. Thank you, T. So first of all, I guess you've probably heard a lot about public health and I guess epidemiology, particularly around our COVID-19 situation. I hope you're all doing well with that as well out there. So first of all, I guess you might have seen us a little bit recently in the news, and these are some of the people who teach into our Master of Public Health that are involved in the degree. One of the main people that you might have seen is Professor Jodie McVernon. So she's at the Doherty Institute and also works for us at the Melbourne School of Population and Global Health, which is where our Master of Public Health is based. And so Jodie is one of the, I guess, chief, how would I describe it? She's one of the chief infectious disease epidemiologists that guides the government as to their approach in Australia around COVID-19. And this is some of the things that you might have seen her on. So she was on Q&A a little while ago. Would you like to go to the next slide, T? And I can move on to Tony Blakely, who is also another professor who works at the Melbourne School of Population and Global Health, who we're very lucky to have as well. And so he teaches also into our Master of Public Health degree. He teaches in Epidemiology 3, which is a subject that I run. And you would have also possibly seen him in the media, or if you haven't, you might see him coming up. So he is very interested in the modelling side of things as well. It is also good to follow on social media too, if you're interested. And so they're just a couple of the people that you might have seen recently. So let's talk about the Master of Public Health, which you are interested in today and which we're very happy about. So the Master of Public Health, first of all, few things to know is that it's an internationally recognised degree. That means you can go anywhere in the world and say that you have a Master of Public Health from the University of Melbourne, and people will know what that means. One of the things that people like about our Master of Public Health particularly is the range of subjects and the flexibility in subject choice. And I'll come to this in a little bit in a minute. And also our Master of Public Health, we have set it up particularly so it is very career and skills focused. And we're going to talk about those things today. So if we pop onto the next slide, T, we can talk about what is involved in the Master of Public Health and some of the things that you would study. So the way we have it set up is that we have sort of three main components of the Master of Public Health. So first of all, we have our core subjects. The core subjects are really aimed at, I guess, helping you develop the skills that we think everybody in public health needs to have. These are around epidemiology and biostatistics, and people love biostatistics with us. I know not everybody might have a great background, but it does work really well. Qualitative research, prioritising and planning, and leadership and management, very important component of public health. Then we have our elective subjects, and we have approximately 60 elective subjects to choose from. And these are in a range of areas, and you can mix and match across all of these areas as you see fit. And so there's health economics, sexual health, health program evaluation, epidemiology, and biostatistics, a lot of subjects to choose from. Our last component is our capstone component. And so this is where students have the chance to do their own individual piece of work. And if we move ahead now onto the slides, we can show you some of the work that the students have done over recent years. I think first of all, we're going to look at our professional practice unit, which is a capstone option within the Master of Public Health. And this is where students go out and work in an organisation for 6 weeks or more. And a couple of projects that students have done in the past, for example, is a program evaluation of the Uday Slum Health Project in Missouri in India, or another student looked at the needs of women from African communities living with HIV in Victoria. And these are just a couple of examples. Our student presentations are next week, I know, in this in our professional practice unit, and I think we have 3 students presenting on their project, which is looking at data quality of COVID-19 data that's being collected by the government, which is going to be an interesting project. Next, we can look at another capstone, which is our research project, which is also a popular option in our Master of Public Health. So these are the individual pieces of work that students do towards the end of the degree. And so if we pop onto the next slide, looking at the research project, what you can see is just some different examples of some things that the students have looked at over recent years. I think these are picked out from last year. So if you're one of those students looked at the socio-economic status, occupation and breastfeeding outcomes in Indonesia over a time trend analysis. Another student looked at the role of unaffordable housing in the association between income and smoking among Australian adults. And another student looked at the psychosocial and practical burden of parental cancer on adolescents. So there's a range of subjects, and every year there's a range of topics that students look at, and every year we have well over 100 students completing projects with us and in a range of different interest areas. Or you might be someone who perhaps is looking to develop that interest area, and students often do that within the degree. So if we move on to the next slide, we can look at some of the other opportunities as well. So maybe and this is another capstone option in the public health in practice, and you can see some of the other options that students have looked at in their final project for this subject. And maybe if we skip ahead, T, to the next slide, we can talk a little bit about one of our elective subjects that is also popular within the degree. This is the primary healthcare in India, in Jamkhed, India subject. So it's a 3-week program that we run in India. It is unfortunately not running this year, I should add, but hopefully we'll be running it again next year. And it's a program where students go to Jamkhed in India for 3 weeks, and they look at what is being done in that area around primary healthcare. And people have certainly described it as a life-changing experience. So if we pop onto the next slide, T, we can pop into have a look at some of the students who are coming into our degree. So one of the things I love about our Master of Public Health, and one of the things that students always ask me as well, people coming into the degree, is it right for me? And that's what I love about public health, is that everyone has a different background. We have lecturers, I'm a physio for an example, is my background. We have lecturers who have done pathology, marketing, geology, which is about as far away from public health, I think, as you can get. There's rocks. But people come from all different backgrounds into public health. And I think everyone brings a little bit of their background with them, whether that's engineering, communications, all sorts of things, nursing, allied health, medicine, and then finds an area in public health to feed their background into. And so there's always a place for you in public health, I think, no matter what your background. And here's some examples of where our students might come from. So if we pop on to the next slide, T, we can have a look at our students. So within our degree, we have kind of 3 different groups, what is how we kind of think about it, I guess, in our degree. We have a large group of new graduates, and we term these students career starters. They're people who have done an undergraduate degree, maybe had a bit of work experience in public health or a different area for maybe a year or 2, and they're looking to start their career in public health. We also have career changers, and these are often early to mid-career working people who have worked already, sometimes in clinical, pathology, different areas, and they're looking to change into public health or move more into public health. And then we have our career enhancers as well. And these are professionals who are working already in government, research centres, senior health officials in Australia and overseas. And we call these people career enhancers. And they're coming to do the public health degree because perhaps they've moved into public health through a different avenue and they never got their MPH and they're looking to enhance their skills. So we think of our students in these three areas, and there's overlap as well. So we move on to the next slide, T. So we have a number of opportunities as well, and I'll talk about a few of these as we go. One of the ones which is very dear to my heart is our exchange program. So we offer exchanges to Canada, McGill University, University of Geneva in Switzerland, Lund University in Sweden, and a very newly developed program which is to the Public Health Foundation in India, in New Delhi and Hyderabad. We had our first group of students planning to go in July to there, unfortunately, and that we can't let them, they're not going. But we are hoping that this program will be up and running, or popular program will be up and running again as soon as we can all travel overseas. So if we move on to the next slide, T. And often, I guess I should add that for exchange, students often do it towards the end of the degree. And so not having it in the first semester or second semester works out fine. So hopefully by the time you get towards the end of the degree, that will work out. We also have a fantastic population health student association, and this is our student association, who organise a variety of activities, social events, speakers, careers nights as well over the year, and they also help us organise the orientation session at the start of the year as well. And if we move ahead again, T. And so let's talk about career outcomes. That's always a question that people have in public health. And one of the great things about public health is that there's a variety of people and careers or backgrounds that people come to public health with, and then there's quite a variety that people leave with as well. I remember a few years ago, we did a survey of our students, and from the 70 or 80 students who answered, we had 52 different career outcomes for graduates. And so it's great because you can tailor your Master of Public Health to what you want it to look like. You can develop those ideas as you go. So from that survey, we did a more recent survey we did about a year ago. Approximately 80 people answered, and these are just some of the outcomes that students had their graduate degree or their graduation, their job on graduation is what I'm trying to say. Yes, we can move on to the next slide, T, that'd be good. And we can take you through a few students and what they've done. So here's an example of a student. She'd done a Bachelor of Science degree. She did her graduate degree in nutrition as well. I think it was a grad cert or a grad dip. She had no experience in public health. She did an epidemiology and biostatistics stream, and she did her research project was her capstone. And we discussed the research project a little bit before. She actually did her research project with me, and she looked at the effect of dogs on mental health. which was a very interesting project. And she now works at the World Health Organization in Beijing. She works in tobacco control and health promotion. And if we take that through to the next slide, T, we can pop onto the next student. Thank you. And so this is a student who did a Bachelor of Social Science. Again, no experience. They did a real mix of subjects across specialisations. And I showed you those specialisations earlier. We had ageing, epidemiology and biostatistics, health program evaluation, health economics. You're never locked into one of those specialisations. You can pick and choose subjects as you feel suit you as you go throughout your NPH. So this is a student did global health, epidemiology, health promotion and mental health subjects. They did some volunteering as well. And their job outcome was they now work as a research assistant in mental health research. I know they love that. They love their job. And we can move through to the next person, T. Again, I think I've selected lots of people with no experience for this presentation. This is a Bachelor of Arts student who came to us. Again, had no experience. They did a variety of subjects, mainly focused on health policy and health economics. Their capstone project was our Public Health in Practice capstone. And they did volunteer work across in different global health organisations. Their graduate role was in the Victorian Department of Health and Department of Premier Cabinet, and it was a new graduate role. And we can move through to the next person, T. Would you like to move on to the next? Yeah, perfect, thanks T. This is somebody who came to us from a Bachelor of Science this time. Again, no experience. They did an epidemiology specialisation, global health subjects in there as well, and they now work as an epidemiologist at the Doherty Institute in Infectious Diseases. And I should actually add as well that for next year, starting in 220, which if you join with that, I'm starting in 221, I'm a year behind. Starting next year, we have new specialisation starting as well in infectious disease epidemiology is one, and also policy and practice. And so we could probably move on to the next person, T. But I'm sure some of you will be interested to see students moving into infectious disease epidemiology. And again, another Bachelor of Science student with no experience. They did a health economics specialisation, and their graduation job was working as a research fellow in health economics at the Cancer Council in Victoria. And we could move on again, T. That might be almost the last one, I think. Next slide, T. Oh, no, one more. Okay. So this is a student who came to us from a Bachelor of Health Science. Again, had no experience. For their MPH, they focused on health promotion and policy, and they did a professional practice unit where they went into an organisation in government, and their graduation role was looking at working in health promotion in a primary healthcare service. And that is the last one. So we can move through, T, onto the next slide. So from our survey a few years ago, oh no, it wasn't that long ago, a year or two ago, we asked students, how long does it take you to get your first role? And you can see there's a variety of times, and it depends, I guess, often when students start looking. For the 80 students, the most common time was 0 to 3 months, which we found very promising. And we can move on to the next slide as well, T. The next slide tells us about what actually helps students students helped gain employment. And I find this slide really interesting because there's actually a variety of so many things that students identified as actually helped them find jobs. So student networks, volunteer work, previous work experience, doing the professional practice unit subject, the research project, and possibly doing internships as well, or sort of volunteer work, I think is another way to word that. All help students identified as things that had helped them find work. So I really like that one because I think that it demonstrates the different things that people can do along with their degree. And I think student networks is probably one that could never be underestimated. And we can move through to the next slide, T. And so you can probably actually skip 2 slides ahead, T. That would be great. Yeah, we can skip that one, I think, and move ahead. Okay, so these are some of the things that we do within the degree that help students identify the roles that they're interested in the future and to access those roles as well. We run a mentoring program for second year students, and students are matched with a mentor in an area of interest for them, and the mentors can be local or overseas. And also I should add, we have students who come from Australia and overseas. And I think about 30–40% of our mentors are located overseas, which is fantastic. And there's an opportunity that's open to our second year students. And if we move on to the next slide, we can see the opportunity that's available for our first year students in our Master of Public Health, and that is our careers breakfast. So we can move on to the careers breakfast. Here's our picture of our careers breakfast. I think this one is from last year. So our careers breakfast is where we have alumni come back to us and they talk about what work they do, how they got their roles. And the way it works is we have about 6 or 7 students meet with one alumni. The students stay put and the alumni move around all of the tables while people have breakfast. And it's always a great event. And the students can ask the alumni what roles they do, how they got their job, all of those things. So it's a great chance for students to hear from people who have been through the MPH and their career trajectory since then. And so that is something that all our first year students are invited to. This year, we're looking to run it in a couple of months and it will be online. And so for those of you who are interested in our Master of Public Health, the selection into the degree requires an undergraduate degree. For mid-year this year, it is 60% GPA, but we are looking for that to go a little bit higher for next year. And advanced standing is offered if you have relevant experience or a health professional degree or public health experience. And I'm very happy to answer questions about that on the chat as well. And so if we move through to the next slide. Good, we can hear from our students. So thank you very much. Very happy to chat if you would like to email me or send anything through on the chat as well. So thank you. I look forward to meeting you in the future.
Thank you, Melissa, with so much of valuable information on Master Public Health. I can see many of your questions have come through, which is really amazing. I thought we might continue with our alumni, Al, Max, and Martha, introducing themselves and share their journey at Master Public Health. So now we start off with Al. The floor is yours, Al.
My name is Elle Peters-Wisniak and I'm a graduate policy advisor with the Department of the Prime Minister and Cabinet, seconded out to the National Indigenous Australians Agency. And I just wanted to stress I was one of those students with no experience that Melissa mentioned a few of. Next slide, please. Thanks. So first of all, I just wanted to be completely honest with you all and tell you that the MPH wasn't even really on my agenda initially. I was actually looking to join or to get into medicine, but when I actually got the offer, I realized that it wasn't for me at all. And the MPH was the natural alternative to that because I realized that I didn't want to just help sick people. I wanted to help people upstream before they were even sick in the first place. Secondly, I knew from my undergraduate degree, I did science at Melbourne, that the University of Melbourne had incredible access to some of the best speakers in the world, and I knew that was particularly the case for their postgraduate students. And then finally, I didn't just want the academic accreditation, I wanted real life skills. And I liked that the MPH at Melbourne Uni had assessments that were modelled off real life, and that the group projects would provide an opportunity to experience interdisciplinary collaboration within the cohort. Next slide, please. So you should be able to see my MPH here. And as you may be aware, there are so many electives to choose from, and it was definitely a huge challenge deciding which ones to pick. So as you can see on the slide, I did the evaluation stream, which involves subjects like program evaluation 1 and 2, and the Indigenous and global health streams with subjects like the primary healthcare subject in India that Melissa mentioned, and also global health and human rights. Next slide, please. So as I've said, selecting subjects was definitely one of the biggest challenges for my time in the MPH. So I've put together a few top tips on how to choose between them all. Firstly, I think it's really important to go with your heart. So what you're passionate about, those specialist content, subjects that motivated you initially to apply. Secondly, try to pick subjects that align to the PPU or research capstone that you want to do, and in turn, what career area you might want to pursue after you graduate. And then finally, as hard as it is, try to balance the subjects that seem interesting to you with the ones that actually have those employable skills. Like for me, it was evaluation, or it might be biostatistics or something like that. Next slide. So just moving on to a few of the highlights that I loved during my time in the MPH. Firstly, connecting with a range of experts in their fields. So as you'll come to learn, public health is a unique sector spanning over a bunch of different industries and professions, everything from data analysis to human rights advocacy, HIV research, clinical pediatrics, et cetera, So something that I continue to be really grateful for was the uni's access to some of the country's, if not the world's, most respected experts. I got to do things like quiz Marcia Langton, I got to go to a conference with Lynn Gillum, and I even got to hold Tilman Ruff's Nobel Peace Prize, which was really exciting. Next slide, please. Sorry, it should be the next one. Thanks. So another highlight was experiencing global health in a real world setting over in India, which is a real disappointment for students in this year, I think, not being able to go, because it was one of the most incredible experiences of my life. I think it's one thing to study public health at university, but a totally different thing to experience it in real life. So seeing how public health knowledge and the transmission of health literacy between communities and members of communities, it was incredible, and seeing how it can empower a whole community, particularly women in that scenario. And I think on the next slide, I've got a picture of the adolescent girls group that we were lucky to sit in on one morning. These girls were amazing. They were learning everything from sex ed to things about gender equity, nutrition, and a bunch of other different health promotion activities. And next slide. And then finally, another one of my highlights was presenting my PPU at the conclusion of my master's. This was a really proud moment for me because I was able to share all of my hard work and the learnings that I'd developed over the last 2 years with all the people that were important to me and I'd made the journey with. And so final slide. So finally, a few takeaways that I brought across from my MPH to the work at the agency. First and foremost, that cultural competency is a journey, it's not a concrete outcome. Secondly, that health really isn't just about the health sector, it's employment, it's housing, and everything else in between. Thirdly, that I continue to appreciate every day the wealth of experience and knowledge that comes from working in diverse teams. And then finally, if 2020 and COVID has taught us anything, it's that public health is always going to be relevant, and I absolutely recommend doing the MPH for everyone here today. So thank you, and back over to you, Peter.
Thanks, Al. It's interesting to know how relevant public health skills you learned with your career. I guess next we have Max, who took a different path in his Master of Public Health and career. Over to you, Max.
All right. Hi, my name is Max. So currently I'm working as a business analyst in the finance department of Alfred Health. And I finished up my MPH at the end of last year and I did it full time. So yeah, that's a bit about me. And I'll give you a bit of an insight into how I essentially went through my course. So if we can get to the next slide. So essentially, if I go back, essentially where you guys are now, a few years, what inspired me to study an MPH at Melbourne Uni? So it was a tough decision. I was always interested in health and well-being and improving people's health. So essentially, a question that people or someone particularly posed to me was like, well, if you see it, do you want to be a clinician or do you want to be working on this public health side? So a clinician is great. It's really empowering. We need a lot of them in our community. However, that is kind of like a one-to-one learning. As a clinician, you can help one other person and you can do that a repetitive number of times. However, if you get into public health, you've got the opportunity to help hundreds, thousands, and if not millions, depending on which sector you're in. So that was kind of a key driver for me choosing public health. And also a side note was improving health outcomes for disadvantaged populations. If you don't already know, you definitely will learn if you do the Master of Public Health. There are some subgroups of our population that have worse health than others, and that's purely from their disadvantage. And I kind of see health is a bit of a human right, and everyone needs a standard of health. So bridging those gaps was kind of another key priority for me. So maybe specifically about Melbourne Uni, why Melbourne Uni and why a Master of Public Health. So I did my undergrad at Melbourne Uni as well, and I really liked the kind of start broad and then end narrow kind of approach that we use. So as I said, I knew I wanted to go into public health, but where and how, I wasn't completely sure. So I ended up getting into a health economics stream purely from the way that the model was set up. I did my core subjects and the electives I chose. I did a bit of a taste of all of them, and then ended up in this economics area. And in addition, I heard a lot of good things, essentially from someone like me speaking to you about the teaching staff and the culture present, and it is all definitely true. So we're going to the next slide. We'll go through these slides reasonably quickly. So essentially, this was my first year. The blue subjects were the core subjects that Melissa and Elle outlined earlier. And as you can see, I tried essentially three tasters, and included that was our India subjects. And we'll jump on to the next slide. So in the next slide, you'll see essentially my second year of public health, a lot of elective subjects in that professional practice unit. And then my last slide, you'll see highlighted in red all of my major subjects. So you can see the first year is very much a bit of a taster year, and then the last year is like, let's hone in and let's focus on areas that you're specifically interested in. So if we go on to the next slide again, I'll talk a little bit about my internship. So I chose an internship because I was interested, well, I was one of those students that Melissa mentioned earlier that I didn't have any healthcare experience or in a professional place. So I wanted to see what it was like and whether what I was studying was as interesting as it was in practice. So after a big roundabout kind of thing, I ended up doing my internship in the DHHS in a team called the Health Reform Office. And essentially what they do is they look at current health policies and try and make them more efficient and plan for the future. So a big thing that the government's facing at the moment is our healthcare is too expensive. So what I was kind of responsible for was researching different ways to fund a public hospital with the aim of improving health outcomes for patients or people like us and reducing costs for the government. My daily tasks were researching projects, being like the basic kind of readings, journal articles, and internal and external stakeholder meetings. And I had the opportunity to go to a public hospital or a few different public hospitals and see how they were delivering healthcare. A highlight was the supportive team. I was lucky enough to be involved in a team where there was about 3/4 of the team was ex-MPH. And as I said, they were working on really interesting projects that were essentially roughly what we're going to be looking at in healthcare for the next 5 to 10 years. The low light was the steep learning curve I faced, being the nuances of public hospital funding, which is a little bit more complex than I was led out to believe. So we'll go on to the next subject, or slide, sorry. So these are my, I'll speak, so we're about to have a look at my personal highlights, being the India subject that I did. And the same as Elle, it was great. It's great to see all this stuff in theory. However, being there and seeing the health outcomes in practice is something that's truly invaluable. And it's great, and also to see the theory that you learn is very practical, and if you implement it properly, you'll have really great outcomes. In India, you can probably appreciate there's a lot of people that need a lot of help, and these people have followed that kind of model and yielded a really positive outcome. So we'll go on to my next slide. So outside of my trip to India, I had a few different highlights. Essentially, I made a lot of friends during my course. You see in there in the bottom left and the top on the left-hand side of the slide. My internship was definitely a highlight. The mentorship from staff was one thing that I think I didn't appreciate as much as I was planning to. Essentially, staffing helped me get into my major of health economics, and some of the extracurricular events on the right there. So my internship, as I said, was a highlight, yeah. And then something that the MPH did for me, which was great, was it stimulated new areas of interest for me. I'm not sure if you're able to read the slide on the top right there. However, that's a bioethics conference. I did a bioethics subject in my first year, and that kind of opened up a whole new kettle of fish for me. I was like, wow, this is bioethics. Didn't really know anything about it before, but essentially every decision I make now in the hospital or in my placement had a bit of an ethics lens on it, which was fantastic. It also made me a little bit more socially aware about the public health initiatives, things like Movember. I did for the first time with a few other MPH students, and it was a bit of fun. We raised a lot of money. So that kind of thing is really prompted me to change and, I guess, develop myself. The last thing I'll talk about is in the bottom right there. This is not public health related, but I had the opportunity. So the Melbourne Uni is really great at, I guess, developing some of your external interests, and I really like playing soccer. And I had the opportunity to go to a pre-COVID Wuhan and spend 2 weeks playing against some other prestigious universities. So that was great. And I believe that is all. There might be one more slide. Let's have a look. That's it.
Thanks, Max.
Perfect, Peter.
Thanks so much for that. I guess who would thought economics plays such an important role in health? And you can do both in a Master of Public Health. I guess lastly, we have Martha, who did her study after Bachelor of Nutrition and fell in love with research. Over to you, Martha.
Hi. Okay, can we see me? Is this working? Yes, here we go. Okay, hi everyone. I am Marta Isela Vázquez. Can we go to the next slide, please, T? So as Peter mentioned, I'm a graduate from a Bachelor of Nutrition, and I work as a clinical dietitian in a Center for Children with Disabilities for 4 years. I'm one of those students that Melissa mentioned to be a career changer. So that was me. I started to realize while doing clinical practice, just like Max mentioned, that there was only so much that I could do to improve the outcomes of my patients, and that most of their eating habits were related to the bigger issues that were determined by their socioeconomic reality. And at the same time, I was also working, you can see in those pictures there, I was also working, doing some activist work as a volunteer at a women's center. That led me to start working part-time for them as an assistant in health programs that aim to improve the sexual and reproductive health of women and adolescents. And my boss at the Women's Center is a Master of Public Health graduate. So her approach to health issues and the way she was aiming to solve them with the center was one of the reasons why I decided to do an MPH. Because it's like Max mentioned, you can really change communities and improve the health outcomes of hundreds or even millions of people by studying public health. So that's why I decided to do the MPH, and I chose Melbourne University because of their gender and women's health stream, which is pretty unique worldwide. Unlike other universities, it's really focused on social inequity and the gender aspect, and it doesn't see women as only reproductive persons, which is what most public health streams do around the world. They have women's and sexual health or women and reproductive health without taking the gender part of it. So next slide, please. Next slide should be the subjects that I choose. Okay, here we go. So here's a mix of both my first year and second year. So these are on one side we have the core subjects that you have to take. I had advanced standing because of my clinical experience, so that gave me the opportunity to graduate without taking 2 of the elective, which was both a curse and a blessing, because as Melissa mentioned, there's a lot of electives and they're amazing. There's a great variety of them, so I had to choose. So in red, you can see the subjects that helped me or led me to my job right now as a research assistant. So foundations in public health, leadership and public health, leadership and management, qualitative research in public health, gender and health inequalities, and all of the research ones. So yeah, like Peter said, I did fall in love with research. We can go to the next slide, please. How did I choose my subjects? I was pretty lost as the first year because I loved everything. And when I first started, I was very scared about statistics and epi because I felt like I wasn't really good at math. But because we have excellent lecturers at the university, it wasn't scary at all. So I was kind of lost in what I wanted to do and which subjects to take. So I organized a meeting with the stream coordinator and asked for her advice. And she suggested to choose subjects that gave me a deeper understanding of the topics that I was the most passionate about, and subjects that will develop my experience or give me new skills like economics. So that's why I ended up taking health economics and economic evaluation 1, which was excellent, because then now I have a full picture of how health systems work, which I didn't do before. Next slide, please. Okay, my capstone research project. Like I said, I always thought that I didn't like research. Turns out that it was, I didn't like quantitative research as much. And then I found out about qualitative research. So I did my capstone project in research, even though at first I wanted to do it in professional practice, like Max did, for example. But because I already had professional experience, my stream coordinator suggested again that I should do research, mostly because she said that if I wanted to do a PhD one day, then that would be a good way to get there, even though when she suggested that, I thought it would be like impossible. And then I chose the capstone research project, and I did a project on the portrayal of cesarean sections on Facebook, and studied the way the media is portraying this major health issue in Mexico when we have really high rates of cesarean sections. And it was a great experience. It was a lot of hard work. I did all of the data collection, and that was one of the highlights. Just like for Elle, presenting my results was really, really a great experience. I love it so much that now I work in research and I want to do a PhD. So in my next slide, what I did for you guys was prepare my survival tips for the MPH. I'm an international student. I'm from Mexico, as I mentioned. So this is what I felt that was the best thing that I can share with you. So the first thing that I can say to succeed in the Master of Public Health is to show up. It sounds very silly, but if possible, don't skip any lectures or any tutorials, and I guarantee you will do well. If English is not your first language, like mine, sit close to the front, makes it easier to understand the Aussie accent. Network and make friends. Volunteering is a good option. There's plenty of volunteering opportunities at the university or outside of university clubs, or join a university club or like one of the sporting ones like Max did. It's okay to ask for help. There's plenty of options. There's counseling and psychological services available for students for free. I know I needed them at the start because it is a lot of pressure when you're international students and you're here on scholarships and everything seems so new, but then you can ask for help and the university will give it to you. There's also free guidelines on short online courses for academic writing that helped me to get good grades on my essays. You can get one-on-one academic skill sessions with an academic expert. I also use them, they're worth it. And it's okay to need extensions when you need them. Also, I feel like as an international student, we're kind of like, depending on the culture, we're not used to asking for extensions for mental health issues. But if you are experiencing extreme stress or something in your life happened that was unexpected, you can get an extension. It's completely fine if you need it. And also, one very important point that I will make is don't worry about the grade. Just try your best and focus on learning, and then the good grades will come later. As someone who graduated with an H1, I can guarantee you just focus on the learning, enjoy the experience and relax, and you'll do great. And after a long day of lectures, it's fine to go out to the pub and socialize and experience the Australian culture, even though right now it's all a bit stopped because of COVID. And yeah, go outside your comfort zone, talk to people who are different from you, and you will learn way more than you could learn from any book. So yeah, that's it. So as you can see, I did it and I loved it. Thank you.
Oh, thank you, Martha. And I guess, again, to other presenters as well, Melissa, Elle, and Max, thank you all. I guess we have a bit of time for Q&A. So we have a lot of questions coming from audiences. And I'm going to put those to our panel members. Anyone is welcome to join the conversations. We will start off with the first questions. I think this question is more for Melissa. Do we have CSP places and for mid-year or start year intake, and how many? Oh,
No, you can't hear
sorry,
me.
Melissa, you are muted just now.
Oh, good. You can hear me going back.
Now we can hear you.
So we don't offer CSP places at mid-year. I'm sorry, but we do offer them in our November round, so for starting early next year. So if you would like to start at mid-year, what you can do, and there's plenty of students that do this, they start at mid-year and can apply, do however many subjects from mid-year until the end of the year, and they can apply for a CSP in that November round of CSP places to start CSP place for next year.
Excellent. I have another question as well. I think it might be you again, Melissa. What are the differences of Master of Public Health with other specialized programs? You know, we actually have Master of Biostatistics, Master of Epidemiology, and online Master of Aging. What are the differences?
Yeah, good question. We do offer a few different degrees. I think the differences are, the way I always think of it is that if you are someone who is really definite on what you want to do, you really want to be an epidemiologist, you really want to be a biostatistician, you really want to specialise in ageing, then by all means choose one of those degrees. It means you just go specialist all the way. The Master of Public Health is probably a little bit different, and I think it's what Al and Max and Martha said as well, in that we have these core skills in public health, and then you can choose your specialisation. So I think the Master of Public Health probably has a broader range of subjects and probably a broader range of core subjects. And so I think it's good. Master of Public Health is good if you're not 100% sure that you want to go down that specialist route, that you want to keep your options open, then that's when I think a Master of Public Health is good. And gives you, I guess, time, if you're not 100% sure, it gives you time to kind of think about what you want to do as well as you go. So the way we do it is that the core subjects are more at the start, you specialise as you go. So it gives you options to develop things as you go as well. And we would have plenty of students who come in and think that they want to be epidemiologists, and they discover a love of health ethics and off they go in that direction. So I think it depends on whether you're 100% sure on that path, one sort of the epi pathway, the bio pathway, the ageing pathway, or you want to keep your options open. Happy to chat further.
Yeah, I was just going to say on that, Melissa, I had no idea what evaluation
No.
even before I started, and I ended up
Oh.
loving it. And now I'm working in an evaluation advice team. So I think, yeah, it's a real choose your own adventure sort of degree, which I loved about it.
Yeah. Yeah.
Yeah, well, I guess it's really good actually to have a lot of options, whichever direction that you want to go, I guess. Now I have second question or third question actually. Do you offer work placement or internship in Master of Public Health? And how do I get selected into one? Maybe we can talk about the quota as well for this placement or internship.
Sure. Yeah, I think, that's a good idea. So we offer, so our 3 capstone options are our professional practice unit, where students go into a workplace for 6 weeks or more, and that's what Al and Max did. Our research project, where students undertake their own piece of research, and that is what Martha did. And then we have a subject called public health in practice, which is where we have different case studies, and I showed you that slide quite quickly because I was moving through it a little bit. Different case studies. We have experts that come in from around, could be in Victoria, could be overseas. They present a case and you have to work through that case and solve kind of the issues that the presenter, the expert in public health presents. So that's a great capstone option as well. You don't have to choose at the start. You can develop your ideas as you go along. Plenty of students change, like Martha said, as they go along. So our professional practice unit has a quota of students that are allowed to do that, because it is quite a lot of organisation. Our research project, PE students need to have a 75 or 70% during COVID situation average to be able to do the research project. And that is the reason that we said that average is simply because if you're getting an average lower than that, it's quite, if the research project isn't easy, it's quite, Martha's nodding at me there, it's a lot of work. And so if you're finding the coursework subjects, doing the research project is hard. And then we have our public health in practice, which is our third option, which is also a great option. And students can choose their own quite large project to do in that public health in practice option. So yes, so for the professional practice unit, there is a quota of students who can do that. And we decide who gets in on that quota based on just what's available in that year, what agreements we have going with different organisations, how it matches with the students who are, what they're interested in. Do we have a lot of infectious disease placements? Yes, we do this year, but maybe we didn't 2 years ago. So it depends on what the students are interested in and matching them up. And it also depends on their marks and GPA average.
Oh, excellent, Melissa. Another question is, I think this is more like a job opportunities after you finishing the Master of Public Health. A lot of our audiences are still asking, what are the job prospects? Which area would you actually go after you finishing your Master of Public Health? Maybe our alumni can actually, contribute to that as well, if you have any opinion.
Yeah, I think grad programs are a really good way to go if you're interested in policy. I know NGOs are also a really great opportunity. They're more community level. I did my PPU at Oxfam Australia in their First Peoples program, and that was a really amazing opportunity. And I know they take a lot of graduates too. Clinical placements, if you have a clinical background, there's just so much you can do with it following your graduation.
Yeah, no, 100%. I definitely agree with that. I think, especially when I was in your position, you guys watching, I didn't know that my job existed, or I didn't know that any of the jobs that I could have done as my placement even existed as well. So there's a few other ones. I had essentially I was looking at maybe Medibank or KPMG, essentially doing like a similar role. And it turns out there's a lot of people that are really interested in health. And once you get into it, there's a lot that you can do. And having a specialist kind of, having an MPH was great because you kind of have that little bit of an insight into what happens that a lot of people are interested in. And it's kind of, for me, it was a little bit of a new space that people were like, oh, great, you've got an MPH. It probably means you know a lot about this. So yeah, some of those less formal things was also really great as well.
Excellent. Sounds really fantastic there. Oh, yes, Melissa.
I was going to say, I think for jobs, and I think it's maybe what Elle said as well, is do what you love, do what you enjoy, I think is really important, because you're good at what you enjoy. You naturally want to do it, and it makes such a difference. So I think rather than worrying too much about, and I know it's easy for me to say, but rather than worrying too much about, oh, the jobs are here, the jobs are there, we would never have planned the whole, well, we never planned the whole COVID situation. We all know that now. But now infectious disease epidemiology, you know, they're desperate for people. And so do what you love. And I think it works out is what I see every day. But you've got to sometimes find what you love. You might not know what you love yet, and that's fine.
Yeah, I completely second that. I didn't even know that my job existed before I started. I didn't know I was interested in policy. As I said, I was thinking I was going to go down a clinical route, just like Max did. And yeah, it all sort of opened up as I went along. But there's no way I could have told myself 2 years ago that I'd be in the position that I am, because I just had no idea that that opportunity was even out there.
Yeah, I would third that. You do what you loved. I went to the gender stream, and again, like I didn't think that I would end up doing research. I thought that I would want to do management of health programs, and then I realized that I truly enjoy doing research because it's a great way to show the inequalities and ways to fix it. So find what you love in the MPH is actually pretty easy because you have so many options. So I think you should just go with your heart and not just focus. Of course, you have to focus on developing skills that will be useful for your future, but try to find a balance when you do focus on what you love and not just what's going to get you a job. And if you're good at what you do, you will end up with a job. Yeah.
Yeah, totally agree on that one. I've got this one interesting question here. How do I know Master of Public Health is the right course for me? And how do I choose the major or the specialization if I'm interested in a field?
Okay. I can answer the second one a little bit more easily, I think. You don't have to choose a specialization. You can pick and choose subjects as you see fit. And I think probably the core subjects gives you a bit of a try before you buy for all of them. And so you can kind of find out bits and pieces and see what you enjoy as you go along. So I would say a good proportion of our students come into the degree with no set plans about specializations at all. And that's perfectly fine. And then some people change midway, and that's perfectly fine. And some people complete a degree fully in epidemiology and work in health promotion, and that's completely fine as well. That certainly happens. And so I think you don't need to worry about that yet for your specialization, and you can pick and choose, and more students pick and choose. How do I know that MPH is the right degree for me? Alumni, can you help me out? Can you help us out?
I reckon.
Actually, go Max.
Right, so I think I'll be brief. Essentially, if you're keen on helping improve population's health, improving and seeing good health outcomes in our kind of society when you walk down the street, then it's pretty good chance that the Master of Public Health is for you. So yeah.
That's a great answer, Max. Yeah, if you have an interest for improving the health of communities and population, then yes. And on a practical level, personal experience, years ago, this was probably 2014, I took an online, remember in Coursera, when Coursera first started, you could take university courses. It wasn't by University of Melbourne, it was by the University of Copenhagen. But I took a tiny course on global health. And that online subject made me realize what public health was really about. And then after looking as an international student, still literally looking for universities all over the world, I realized that the University of Melbourne was the one for me because it's an excellent program. Glad I didn't do it in Copenhagen. Uh, so that could be a good way to take a look at the subjects and learn what they are about and see if that's something that resonates with what you're interested in. Yeah.
I would also add that I just think it's a really good degree for people who tend to be big picture thinkers, who like to think about things in a global scale or cohort levels, like Max was saying, specific groups of populations who face disadvantage, thinking at that higher level rather than one-on-one with your patient. And yeah, the degree to which you want to make an impact in your career. I think the MPH is really made for people who think at that high level.
Good answer. And I think one of the things as well that I thought of as well is probably one of the ways to know is if you're interested in reading about COVID-19, because we are living public health at the moment. So if you're someone who reads those articles and reads those articles about, oh, well, it looks like these people, you know, who maybe have more socioeconomic disadvantage, or they're more likely to hospitalize from COVID, or look at the numbers, or look at something around COVID-19, well, that's probably a really good sign that you're interested in public health, because, yeah, we are right in the middle of it at the moment.
All very good answers. Wow, we actually have a lot of questions. I think we will be staying here overnight answering all these questions here. Just looking at some of the questions, I guess, pick and choose, I guess. One question, probably Melissa can actually help on this one. For 2021, what are the new specializations that will be offered? And what is the new GPA requirement?
Oh, okay, good question. So I can't be sure yet. It's still getting passed through all the university proposals. So we are setting the GPA requirement for next year at 65 rather than 60. And our new specialisations, is there is a policy and practice specialisation coming on board for next year, which we're excited about. And also we planned this one end of last year, but we have an infectious disease epidemiology specialisation starting as well next year. We're excited about too. And so we are losing the ageing specialisation, is one that it wasn't being taken up so much by students, so that one is disappearing. And the other one stays the same. That's okay.
Thank you for that. Another questions, probably for Melissa again. This is a bit more generic, I guess. When you're looking at the applications, which one is more important, the web or the work experience?
Okay, so for getting into the degree, you just need to meet the selection criteria. So there's no ranking or anything there. When it comes to Commonwealth supported places, the way we do it is that it gets a little bit more complex. So we have 3 buckets. I don't know if buckets is the right word, but buckets is a word we use anyway. 3 buckets of people who come into the degree. And so there is the people who have no public health or health experience. There's the people with their professional health degrees. And then there's the people with public health experience. So there are our 3 different buckets. Public health experience, people with health experience, professional health degrees, people with no experience. And so the no experience people, we tend to rate on, or no health, professional health degree, we rate on GPA. For the health degree people, we rate on a mixture of experience and GPA, and mix in a bit of university as well in there. And also then we have our public health people degree, and we rate that on level of experience. And so we have 3 different sort of criteria depending on which bucket you fit into. It's quite complicated.
Okay, that makes sense.
Yeah.
Yeah.
Oh, good.
It's quite complicated. Yeah, but it does actually make sense, Melissa. No,
Yeah.
we
And
got
it's always
questions.
Oh,
Sorry, Melissa.
go, Peter. That's okay.
Go on.
No problem. You go.
question from probably more than one student. They're trying to look at the Master Public Health from a different university, I guess. So what is the difference of our Master Public Health compared with some other university within Australia, I guess?
Okay.
And I guess what the students trying to say.
I can answer
Yeah.
that from my personal experience. One of the reasons I chose the MPH at Melbourne Uni is because I know a lot of the other MPHs are online courses, whereas the Melbourne Uni one is face-to-face, so it gave you that opportunity to interact in a more intimate setting with the speakers that were on offer and the tutors as well. And I thought that was a really that would be really meaningful for my student experience, and it definitely ended up being the case.
Yeah, I would add to that one of the reasons why you do want to have it face to face is because the lecturers and the tutors are so amazing. We have one of the, if not the best experts in Australia working for the university and teaching us. So that's a great advantage. And that's not just in Australia, it's also of the world. Like I think Professor Dallas, we can all agree, is a legend, and he's with us. So from an international perspective, the University of Melbourne not only has these expert and amazing lecturers, but it's also the way the program is built is very different to other universities in the world, because it gives you that choose your own adventure, as Elle puts it, that allows you to discover what you truly like or what you're truly good at. So that's one of the reasons why the University of Melbourne is such a great option.
It's really good to know
And
that.
I would. Can I add one thing, Peter?
Yes.
One
Yes,
of the
Lisa.
things I think is great about our degree is our students. We have a great mix of students from different backgrounds,
Definitely.
different countries. I think we have 34 different countries, students from 34 different countries coming in. We have a big group of students coming from Australia. They come from all over Australia. And then this great mix of international students. And the people you sit next to each day can be, they could be working in, they could be a fly-in, fly-out infectious disease epidemiologist. They could be a new grad who's just finished their Bachelor of Arts. It's just a great group of students who come together with the shared idea of improving the health for the globe. And so everyone has a home in public health, I think, yeah, is one of the great things about it. And I think in our degree, there's just the students seem to just mesh really well from where I sit.
I was actually going to say that
totally
in response to the question earlier about not knowing what stream to take, is that there are so many resources available to you while you're there, like the student coordinator or subject coordinator rather, but also the cohort. Like I think the people that I sat next to, as you say, Melissa, were incredible. Like some of them were, you know, world-class professionals themselves, and just talking to those people really helped me find my path and what subjects to take next semester or next year, whatever it might have been. So that was an incredible asset to the MPH at Melbourne Uni.
Yeah.
Yeah, well, I guess with so much of diversity there, I guess we can actually learn from each other as well, I guess. We got questions. Probably the alumni can actually help on this one. Can you talk a bit more on your, do you actually have the volunteer experience, and can you talk a bit more on the volunteering experience?
Volunteering as in my PPU?
Any PPU or in your Master Public Health?
Yeah, well, my PPU was probably the main one for me throughout the year. I worked with Oxfam Australia on their First Peoples program and their schools program. My project was essentially a qualitative review or internal review of one of their Close the Gap resources. So I was looking at the language used in one of their education resources and examining whether it implemented deficit-based language or strength-based approaches. And yeah, that's what I presented on at the end, and I presented the findings to the Close the Gap Coalition and the CEO of Oxfam Australia and everything. That was an incredible experience. In terms of other volunteering or co-curricular sort of stuff, I also attended the bioethics conference that Max was talking about, which was an incredible experience as well. Got to hear some amazing speakers, made me think a lot about the kind of work that I want to do in my MPH at the time and then beyond that after I graduated. I can't remember.
Thanks so much, Al. That's very good, actually. I guess I have to ask you to put a last question here. This is probably for our alumni here. Can any one of you, or maybe can all of you actually, talk about what was the most academically challenging aspect of Master of Public Health?
I'll start.
Okay, go ahead.
For me, the most challenging academically was academic English writing. I felt that my English was great. I had like good English test results, and I figured I could do it. I've been reading academic English for years. I got this, and then I did my first essay, and I realized I didn't. But the university has amazing resources to help you out with that. I found out that through the orientation class that we had the option to go into the university library website, and you can take a little online course that is free. And it took me a couple of days to finish. And after that, I started just getting H1s in every single one of my essays. So I think that it's really helpful to use the resources that are there, and the university does help you with it. So no matter what you might find the most challenging academic, might be maths. I don't know what's for Max and Elle. I'm sure they'll tell us right now. But what's important to know is that the university is there to help you and to support you, and that your lecturers and your tutors want you to learn, and they want to help you. So nobody's out to get you. So if you have trouble and you ask for help, you would get it. So yeah.
Do you want to go? Or do you want me to go?
Any comment, Max, Al?
Yeah. Okay. Just on what Martha said at the end there, I picked an economics stream without having ever done any economics before. So that was, I thought was going to be a really, really challenging and complex kind of path. And in the first few weeks, it definitely was. Like in the first few weeks, I remember sitting there being like, wow, there's a lot of terms that I've never heard. And it was just like just a swarm of information that was, out of control. However, there was a lot of, my lecturer specifically, his name's Arthur, was great. And a lot of the tutors that came in were really great at providing resources for people like me. And I reckon maybe half to 2/3 of the cohort or class, which was only maybe 20 or 30 people, had never done economics before. So it was a really great kind of way to get me up to speed on this kind of economics understanding and knowledge and just key terminology that I guess I probably wasn't accustomed to before. So yeah, essentially, if you go into wanting to do a stream and you're worried that you don't have a background in it, it's really not a concern, because the staff will definitely, and also the peers, you would definitely get supported through that. So,
yeah. For me, mine was probably similar to Max. I took comparative health systems, which was a short intensive, mostly centered around health financing and health systems, and it had quite a strong economics base, which I had absolutely never done before, and I found the staff incredibly helpful during that time. I reached out to them a lot, and they were incredibly helpful. I ended up loving it, and I ended up working for Nossal Institute straight after on a health financing project. So I think you should definitely try to push yourself to things that you might find challenging, or you might initially doubt yourself. But my advice would be definitely jump in, give it a go, and the university has so many resources to help support you through it.
It's very good insight, Al. Thank you, Al, and thank you to Martha, Max, and Melissa. It's really informative. I'm pretty sure all our audiences find it really valuable here. So I guess it's the end of this webinar. We have to wrap up now. To some of the questions that we have not been able to get around answering those, our team will follow up and contact you and email you. If you would like to have a one-to-one consultation with our team, please feel free to contact us. The details will be provided in the follow-up email sent tomorrow. I guess thank you all for joining us, and have a good night.
Thank
Bye.
you.
Okay, thank you. Thank you, Peter. Nice to see you. Thank you, Al, Martha, and Max. Good to see you.
Thank you.
Thank you.
Thank you.
See you guys.
Bye. Good luck.